Hello, welcome to Income. In this particular video, we are going to discuss the diagnostic strategies used in primary healthcare. So, the term diagnostic strategies in primary healthcare, we have to know the three terms. What actually diagnosis refers to? What do you mean by strategy? And what do you mean by primary healthcare? Then only we can able to have what are the different diagnostic strategies as such. When you think about the diagnostic strategies, it actually involves two different words, diagnosis and strategy. The term diagnosis refers to the process of determining the nature of the disease and distinguishing it from other clinical conditions. For example, if the person is taking more amount of the Ruksha Ahara, there may be a possibility of Vata Dosha Vishiyation. How this is different from the Vata Dosha Vishiyation, which is considered to be happening because of the Lagaguna or because of the Shita Guna, or because of the Chala Guna, or because of the Ruksha or Laghu Guna, etc. In that way, so the diagnosis will be helpful in determining the actual cause of the disease and the outcome of that particular disease. That means the effect of that particular exposure to the cause. So this is what is considered to be the diagnosis as such. And when you think about the strategy, it is nothing but a long term plan, long range plan, wherein we are going to set the goals as far as the cause of the disease is concerned. We are going to determine the plan of action, what should be done initially, what should be done next, what should be done at the end, etc. And we have to use the mobilizing those resources, the present resources or available resources to achieve that particular goals. So that is in this particular occasion, diagnostic strategy is being used to identify the actual cause of the disease. So by identifying the actual cause of the disease, we are going to identify how far this is responsible for the curability and incurability of an illness, or otherwise how far we can able to identify the prognosis of the disease, and how far we can able to say the disease is curable after how many days, etc., etc. That we are going to plan while looking into this particular diagnostic strategies as such. As far as primary health care is concerned, whenever if you think about the primary health care, so that is considered to be the primary health center wherein the patients are going to come to the um, hospital or the area where the primary care will be provided to the suffering individuals. So to this particular type of the healthcare setup will be helpful in promoting the health or in preventing the illness. So, or if the person is suffering from the disease, to make sure that the cure of the disease is possible. And if the person is suffering from long-standing illness as such, wherein rehabilitation of the disease can be planned. And if the person is suffering from any kind of the severe disease, palliation of the clinical symptoms, they are being planned in this particular primary health care setup. So this is what is considered to be the primary health care. When you think about the diagnostic strategies, so we are going to apply the principles of diagnostic strategy in this particular primary healthcare setup. So whenever we think about the uh, diagnostic reasoning, diagnostic strategies, they are of three different stages. The first one, that is initiation with the diagnostic hypothesis. Then comes refinement of the diagnostic hypothesis. And finally, defining the final diagnosis. These are the three different strategies that will be planned whenever, if the uh, diagnostic strategies are being planned at the primary healthcare setup. So these three different stages are having the further subdivisions. For example, in case of the initiation diagnostic hypothesis, several terms are being used. For example, spot diagnosis, self-labeling, presenting complaint, and pattern recognition trigger. Whereas, if you think about the refinement of diagnostic hypothesis, they are of further categories, that is restricted rule out, stepwise refinement, probabilistic reasoning, pattern fit, and clinical prediction rule. As far as defining the final diagnosis is concerned, further strategies are there, that is known diagnosis, further tests ordered, test of treatment, test of time, and no label apply. So these are the outline of the three stages of diagnostic strategies that are used in primary healthcare. Coming to the first one, that is initiation of a diagnostic hypothesis. The first and foremost thing, that is spot diagnosis. When you think about this, whenever a person is coming to you, we are going to make the diagnosis by few sentences, or by in a matter of a minute or two, we are going to make the diagnosis. So this kind of the strategy that is arises from the unconscious recognition of a particular non-verbal pattern that may be either visual, such as deformities, that may be either auditory, such as abnormal heart sounds, abnormal lung sounds, or the abnormal voice, etc. And the peculiarities of spot diagnosis will be they are usually instantaneous, and that is usually involving fast thinking process, or otherwise that is considered to be intuitive one, intuitive diagnostic approach, plus that will be system one thinking approach can be uh, applied here, and it is considered to be the modified pattern of a pattern recognition model, wherein the whole spot diagnosis concept that relies on previous non-verbal experience of the condition. For example, here the left image, the person's eye is being examined. That is showing the yellowish discoloration of the sclera. So whenever if you think about this particular clinical presentation, the spot diagnosis favors towards hepatobiliary dysfunction. Of course, this may be possible because of the RBC destruction. This may be possible because of the liver dysfunction, or this may be possible some kind of the obstruction that is present in the gallbladder or common bile duct or pancreas, etc. So like that, the overall strategy will be hepatobiliary dysfunction that can be identified. And whereas the extreme right image, we are seeing the deformities of the joints. So this is specifically indicative of a rheumatoid arthritis, that is advanced stage of a rheumatoid arthritis, wherein the complications of the disease rheumatoid arthritis are being seen in this particular hand as such. When you think about the next images, so here the person is having the pain in the knee joint. So that is considered to be the spot diagnosis in that particular situation will be the person may be suffering from degenerative joint disease of a left knee, or otherwise osteoarthritis of left knee can be diagnosed. Whereas the right one image, that is showing the joint swelling of the right knee joint. So here the diagnosis of this, that is the right osteoarthritis of the knee, that can be diagnosed. So like that, spot diagnosis will be done in a minute or two by looking into the patient's presenting complaints. Next, regarding the self-labeling. So here, the term self-labeling refers to the patient's perception of their presenting complaints. So this can be either patient's previous experiences or because of the problem they have seen in their relatives or in their near and dear ones. So here the extreme left image that is showing the yellowish discoloration. Probably most of the patients may say they may be suffering from the liver dysfunction, whereas this may be the patient's perception. Whereas the extreme right image, wherein the persons may present with their perception may be the severe joint pain, inability to do any of their activities, such as lifting the objects or doing the food, etc. So they are in a they difficult to do. So that is their perceptions as such. So that means the left one probably it may be causing some kind of the discomfort to the patient, whereas on the right image, most of their routine activities that may be compromised. In the left one, the person may do their routine activities, whereas the right image, that is where the person is suffering from the deformities of the joint, most of their routine activities they get compromised. So this is what is considered to be self-labeling. As far as presenting complaint is concerned, that has to be mentioned depending upon their chronological order of manifestation. When you think about the presenting complaint, that term presenting complaint refers to the most troubling symptom that makes the person to visit the doctor, or that makes the person to visit the hospital or their private clinical setup. So that has to be mentioned. Based on that, the diagnosis may be done. Suppose in this particular occasion, the person is having the chest discomfort and the manner of their hand that is showing the person may be suffering from cardiovascular dysfunction. That is, the chest discomfort may be due to cardiovascular disease as such. The two, cardiac disease. As far as pattern recognition trigger is concerned, here the we are going to identify the patterns that are being presented by the patient as such. So here, this particular pattern recognition can be done based on the history or based on the physical examination or based on the history as well as physical examination. Whereas in this particular left image, the person usually says the pain in the left side of the chest as such. So if this is repeatedly is being observed, that is that is showing there is a specific type of pattern in presenting complaint. On examination, probably we may get the abnormal lung sounds or abnormal heart sounds, that is in the form of the murmur, etc. We can able to appreciate. Whereas the right image, wherein we are going to observe the anteroposterior diameter is almost equal to transverse diameter, where this is being considered to be the barrel-shaped chest. And this is specifically seen in the patients who are suffering from chronic obstructive pulmonary diseases. Now, let's come to the second step of the diagnostic strategies, that is considered to be refinement of diagnostic hypothesis, which involves 5 different steps. Among them, the first one is restricted rule out. In the sense, so we are going to identify the presenting complaint. So when you think about the presenting complaint, so we have to identify what are the possible causes of the presenting complaints. So, and for this, we need to know about the list of the presenting complaints of different systems. What are the symptoms are observed in respiratory diseases? What are the symptoms are observed in cardiac diseases? what are the symptoms are observed in musculoskeletal diseases, what are the symptoms that are observed in alimentary canal diseases, or what are the symptoms are observed in case of nervous system diseases, etc., etc. So here, whenever a person is presented with chest pain, so that is basically present in either respiratory disease or cardiac disease or alimentary canal disease or musculoskeletal disease or neurological diseases. Each of these particular diseases are having the typical clinical presentation. Based on that, we can able to rule out the diseases as such. For example, if the person is suffering from pain on either sides of the chest, and that is being usually being associated with cough, then that is usually attributable to the chest discomfort may be occurring due to respiratory disturbances. So wherein the chest pain, and that is considered to be present on the retrosternal region, radiating towards the radiating towards the left shoulder, etc. That is usually indicative of cardiac dysfunction. Chest pain that is usually worsening on ingestion of the substances, etc., associated sore irritations or burning sensation, etc., that is attributable to alimentary canal dysfunction, wherein the musculoskeletal chest pain that is usually aggravated by change of posture, that is from the recumbent posture to sitting posture, or from the sitting posture to recumbent posture, or from the right lateral to left lateral posture, etc., etc., that is indicative of musculoskeletal chest pain. Whereas the chest pain, if it is occurring due to neurological dysfunctioning, that is attributable to the chest pain that is occurring in the dermatomal presentation. So like that, the restricted rule out helps us in ruling out the different systemic diseases based on the nature of the presenting complaint or based on the other features of presenting complaint as such. As far as stepwise refinement as a diagnostic strategy is concerned, so this is actually helpful in determining the anatomical location of the problem or probable underlying pathological process. So let us say, if the person is having the presenting complaint of cough, that may be happening either because of the pathogen entry through the nose, or the pathogen entry through the mouth, or the pathogen entry happening through the uh, esophagus, or the pathogen entry through the heart as such. Each of these areas are responsible for the typical cough generation as such. For example, if there is entry of pathogen is happening through the nose, initially that will be associated with sneezing. Then that will be associated with nasal secretions, may be associated with cough, etc. In this way, the probable route of entry through the nose can be predicted. If the entry of pathogen is happening through the oral cavity, this particular sneezing may be absent. That may be associated with cough, etc., and the person may have pain on either sides of the throat region. Suppose if the person is having the entry presence of cough due to the entry of the substances through the esophagus, then either the pain in the throat or sneezing, etc., that may be absent. Wherein the cardiac dysfunction, if it is having the pain, if it is having the cough as such, that is may be usually attributable to pink Frothi sputum, that is attributing to the dysfunction of either left ventricle or left atrium as such. So like that, stepwise refinement helpful in predicting the possible anatomical location or otherwise the probable underlying pathological process in the patients as such. As far as probabilistic reasoning is concerned, we can able to identify the positive or negative result of an examination technique or test to identify the probability of a particular given disease. For example, here the person is suffering from pleural effusion. So here the method of examination that is being done is identifying the apex impulse. When you think about this, the if you are observing the apex impulse lateral to the mid clavicular line that on the left side, that may attribute to the pleural effusion on the right side, or otherwise there may be a possibility of collapse of the lung on the left. So in this particular image on the right side, so there is a pleural effusion on the left that usually responsible for the shift of the apex impulse towards the left sternal border. So wherein the yellow colored image will be helpful in knowing about this, the sign as such. So here the positive one, that is the shift of the apex impulse towards the right side and absence of the apex impulse on the nearer to the left mid clavicular line, that is suggestive of the pleural effusion on the left or otherwise collapse of the lung on the right as such. So this has to be done by looking into the necessary physical examination. Here sometimes even the percussion of the chest may also help, or keen observation of inspection of the chest may also be helpful in making the diagnosis of a pleural effusion. Of course, this will be confirmed by the lab, specifically X-ray chest as such. As far as pattern recognition fit, in the sense, in this particular aspect, its use mainly relies on the memory of known patterns, but no specific rule is specifically used in this particular strategy as such. So, for example, if the person is doing the work in this particular occasion as such, so we can able to observe the entry of the pathogen through the nose or oral cavity. Thereby, the person may have the sneezing, etc., or the person may have the pain in the throat, etc., that may be possible. So, like that, so the symptoms and signs that has to be compared with the previous patterns. Whether the particular presenting complaint were being present in the previously in the similar situation, that has to be identified. As far as clinical prediction rule, so this is nothing but a formal version of pattern recognition model. For example, if the person is having the dust exposure, same person is having the habit of consumption of curds frequently, or the person is having the habit of smoking, and at home he is having the cat as such. So that means all these are usually indicative of if at all, if the person is presenting with the presenting complaint, probably that can be attributable to respiratory distress or respiratory discomfort as such. Probably the diagnosis may favor towards the bronchial asthma. So like that, the clinical prediction will be helpful in making the diagnosis as such. The third step of the diagnostic strategy in primary healthcare, that is defining the final diagnosis. So, which again further involves 5 different steps as such. The first one, that is known diagnosis. So that is here that sufficient level of certainty of diagnosis to start appropriate treatment or rule out serious disease without further testing. For example, the person is suffering from chest pain. present on the left side, and worsens of climbing the stairs, getting relieved by taking rest as such. This is indicative of the person may be suffering from the cardiac dysfunction. So here the probable diagnosis we can able to make by looking into that the person may be suffering from the ischemic heart disease as such, so that the early treatment can be done in this particular occasion. Suppose if the person is having very serious cardiac disease, such as myocardial infarction, so this particular starting the treatment at the earliest is playing major importance as far as further tests are ordered. So strategy is concerned. So this is considered to be the standard test procedure to rule out the different diseases as such. For example, chemical examination of urine that involves 5 different uh, tests as such. Hematuria to identify the presence of the blood in the urine sample or bile salts. So in the urine sample to detect the hepatobiliary dysfunction, and ketone bodies to detect the nutrition deficiency, and glucose to detect the excess the glucose in the urine such as the hyperglycemia effect, proteinuria to detect the renal dysfunction as such. So like that. So these further tests may be helpful in channelizing the diagnosis as such. As far as test of the treatment is concerned, so this is usually practiced when the person or when the doctor is having the uncertainty in their diagnosis. That is giving the some kind of the treatment which actually either improves or worsens the presenting complaint, that confirms or rejects the diagnosis. For example, in this particular occasion, an oil is being applied on the knee joint. If it is improving, then we are going to make the diagnosis of the Sandhikatavata. Or otherwise, if it worsens, then we are going to make the diagnosis of Amavata. So like that, the test of the treatment may helpful in making the clinical diagnosis. There are certain occasions wherein the treatment may be uncertain also. In that particular situation, we are going to give the medication and we are going to observe for certain time duration. That is what we can say wait and watch approach. So to know about the improvement or worsening of the clinical condition. Thereby, we can able to make the diagnosis as such. Whereas the last one, that is no label applied. So here, most of the occasions, the persons may be having the presenting complaint. They are often vague. They are not following any particular pattern as such. In that particular situation, we have to go towards the patient again to recall the patient for further review. Suppose if the person is having any kind of the point that were being missed, that can be checked again. Or otherwise, we have to do the explorative investigation as such. And by that, we are going to share the uncertainty towards the patient also. And the next possible ways we can able to send to the higher centers for the second opinion. To sum up, the different diagnostic strategies are adopted when a doctor is interacting with the patient depending upon one's knowledge or cultural variations, etc. etc. Diagnosis becomes the key in making the prognosis of the diseased individuals. How far the disease is curable or incurable, etc. And diagnosis becomes the key in planning the appropriate treatment also. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video you'd like to hear in the next video in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement with this particular small message. That's all for today. Something more in the next video. Thank you.